Assalamualaikum warahmatullahi wabarakatuh, maam. Sorry, ma'am, my name is YEKTI SYAHRANI. Let me present about my journal. And title is Chronic Bronchitis in West Sweden, a matter of smoking and social class. Okay, first, background. Although chronic bronchitis is associated with inferior quality of life, hospitalization, and increased mortality, it has been less in focus after the introduction of the term chronic obstructive pulmonary disease (COPD). There are no recent published data on the prevalence of chronic bronchitis from Scandinavian countries. First, the main aim of the present study was to estimate the prevalence of chronic bronchitis in the West Sweden by using data from a large-scale epidemiological study of the general populations. Number two, the future aim was to identify current risk factor for chronic bronchitis in a population with a major decrease in the proportion of the smoker. And then, method. Study sample. Study sample was derived from the population-based West Sweden asthma study, WSAAS, which has been through notice described elsewhere. Data collections. Data were collected through structured interview based on the Swedish OLIN questionnaire. And then, definitions. Chronic bronchitis was defined as having sputum productions when charging on most days for the last 3 months during 2 subsequent years. And then last, analysis. All statistical analysis were performed using SPSS version 21. From the method, from the 18,087 questionnaire responded out of 30,000 invited to the filed clinical examinations, which included, among others, spirometry and structured interview. Chronic bronchitis was defined according to reported symptoms. Next. Result. Okay, the result of the journal. Number 1, prevalence of bronchitis respiratory symptoms and physician diagnosis on disease. Number 2, chronic bronchitis is a relation to asthma and COPD. Number 3, prevalence of chronic bronchitis by demographic variables, smoking habits, and PEP years. Last, number 4, risk factor, chronic bronchitis, and respiratory symptoms. Last, conclusions. In conclusions, the estimated prevalence of chronic bronchitis was lower than previously reported examinations from West Sweden, suggesting a decrease in the prevalence which may be due to a reduction in tobacco smoking during the last decades. Current studies suggest that chronic bronchitis is a condition related to smoking and social class, and current smoking in combinations with lower level of education further increased the risk for the conditions. Okay. Thank you for attention, maam. Have a nice day and stay healthy, maam. Wassalamualaikum warahmatullahi wabarakatuh.